Hello, my name is Lidia Schapira. I am a medical oncologist and a professor of medicine at Stanford University. I attended the Choosing Wisely meeting and was thrilled that they included the topic of cancer survivorship in their program. Cancer survivorship is really an emerging concern for all cancer doctors, clinicians, patient advocates, and public health specialists. As we have learned to detect and treat cancer more successfully, we have a growing population of people who have lived beyond a cancer diagnosis. And an inclusive definition of cancer survivor is anybody who has heard the word "you have cancer" for the remainder of their life. We talked today about the fact that many of the syndromes that emerge during cancer treatment, such as chemotherapy-related peripheral neuropathy or lymphedema or psychological stress, such as fear of recurrence and anxiety, often persist after cancer treatment and requires monitoring, surveillance, referrals, and treatment. We also talked about the fact that there may be late effects of cancer treatment, for instance, problems that arise years later because of a particular treatment somebody received. So we talked about the need to have a summary and a care plan to help guide the patient and the primary care clinician and the oncologist. We talked about the fact that we need new models of care delivery that involve preventive care and therefore involve family doctors and primary care physicians. We also talked about the importance of having patients identify some of the problems to speak up. We talked about the value of peer support and support groups, and sometimes the need also for specialized, dedicated mental health interventions for those dealing with trauma, PTSD, fear of cancer recurrence, and anxiety and depression. So finally, what we really talked about are the resources that are available for clinicians who are doing this kind of work. There are resources that are free and available from the NCCN, the National Comprehensive Cancer Network, from the American Society of Clinical Oncology, ASCO. There are resources for clinicians, guidelines for survivorship care, models for cancer survivorship care plans and treatment summaries that are downloadable, and as well resources for patients. So if patients can have a guide to healthy living and a guide to cancer survivorship care. We also addressed some of the problems and barriers of delivering this care, such as the fact that often primary care physicians don't feel comfortable or well educated to provide this kind of care, and the need to think about novel ways of including them, because preventative care is a very important aspect of cancer survivorship. So in the past, we focused so much on just treating, curing cancer. We really didn't think too much about what could happen to the people who were treated and cured years down the line. Now we know that they still have persistent problems and that we need to address them. And so it's time for all of us, wherever we practice, to think about ways of reaching cancer survivors, listening to them, monitoring them, and providing the treatments that they need to lead the best possible lives that they can. Thank you very much.